energy and thriving for more information at the end of a long day. But never mind. We have the pleasure of Fabio Roncoroni, Director of Supply Chain Artworks and Labeling in Global Operations, Roche USA. Fabio is going to be speaking about managing the supply chain under risks of a disruption, how to prepare and execute a business continuity plan. Welcome, Fabio. Thank you for giving us your time this afternoon. And you may fire away when you're ready.
Thank you so much, Tonya. Cool. So great hearing from all of you. So let me share my presentation. You should be able to see the screen. And what I'm talking about here is about exactly, so how do we manage the supply chain when there is a risk of a disruption? And specifically, I find this extremely important to get ready to try to avoid any specific backfill on whenever we have a disruptive event. And I don't think there is a better year than 2020 to talk about this topic. So first of all, I can give you a very short introduction about Roche, and then we can look at why it's important to manage the supply chain in case of risk of disruption. And we will go then in section 3 in more detail around what is business continuity plan and how this methodology has been used in Roche. Of course, we will look forward to some Q&A at the end of the session. In terms of Roche, Roche is a huge company. It's a global company which has more than 94,000 employees, and it's spread across the globe with 150 countries where we have our company around. It was founded in 1896 in Basel, Switzerland. We are an healthcare company which is specialized on research. And on average, we have every time around 100 molecules which are under evaluation. We are the biggest biotech company in the world, and we are the world leader in oncology, specifically anti-cancer drugs and in vitro diagnostic for how to identify and potentially avoid to have to cure any type of diseases. Of course, we have high commitments with patient and personalized medicines. And one thing which I would like to highlight is that we have many different manufacturing plants which are spread out across the globe. We have one manufacturing plant for diagnostic in Cape Town, South Africa. And then we have many others in Europe, in China, in Asia Pacific, as well as in North America. I'm personally located in California, and we have a manufacturing site here in Santa Clara. One of the other things which is very important about the company is that we do care a lot about research and development, and we do every year strong investments on this area. Cool. In more detail, if you look around Roche, it's divided into two main areas, actually three, is pharma, diagnostics, and within diagnostics there is also Roche Diabetes Care. The pharma site is, so basically it's consisting of three companies that merged together. One is Roche Pharma that acquired a few years back both Genentech, which is a leading company on the oncology and biotechnology business, and then Chugai in Japan. On the diagnostic side, we are divided into four main areas, which Roche Applied Science, molecular diagnostic, professional diagnostic, and tissue diagnostic. The manufacturing site, which is located in Cape Town, is belonging to the Roche molecular diagnostic business. Okay, so this was a short introduction to give you a picture of what we are in terms of company, and to give you a flavor also why it is important for us to avoid disruption during a catastrophic event. And that's mainly because we do provide medicine to patients and solutions to patients for which their life may be at risk. So So it's very important to avoid any disruption in the supply chain, to have no patients which is impacted by that. If you go in more detail, so if every type of industry, I think, has been confronted this year with COVID-19. So whenever we talk about possible risk of a disruption, so that's the first thing that comes into mind looking at this year. So this had an impact in all of the industries on people availability, on raw material supply, because originally all of the suppliers out of on the Asia Pacific, specifically out of China, were at risk, and later on the raw material supply in general around the globe has become a potential bottleneck. And then, of course, with a lot of travel restrictions, so also there were less flights available also to bring the goods from one place to another one. Specifically out of South Africa, we have been experiencing some challenges in a couple of months on availability of flights to go from and to South Africa. Similarly, there has been some challenges around the globe on logistic availability. So if we think that disruption has been 2020, that's not the case. So if you look back, every year was related to some disruption in a way. This is just a snapshot of 2017. So 2017 was as well a year full of disruptions for the supply chain, with many things that happened in various parts of the globe and in various shape or form. So from flooding, where we had also in Asia and in China some flooding situations, to some meteorological events like hurricanes, which is happening every year in the North America region, to some of the wildfire which was hitting California, same happened this year, as well as in 2017 also in South Africa. So plus many other type of things which do put at risk our supply chain. And that's why it's so important to look ahead and see how to have a plan B in place in order to be able to overcome those situations. In a similar way, we also had we have an overall increasing risk on threats on cybersecurity attacks. Cybersecurity attacks are going to become more and more a pattern, and that's something as well that we need to make sure that we are ready. Given the fact that supply chain is becoming more and more digitalized, it's very important to be looking proactively at how to increase our cybersecurity and how to avoid any type of attack in that area. This is just an example. In 2019, there was in Germany, there was a cybersecurity attack which was impacting different companies, inclusive of Roche. All in all, just to summarize why it is important, if you look at some statistics, and we can see that a lot of companies which are impacted by some type of catastrophic events, a good 40% of those companies, they do not reopen again after those catastrophic events. Their impact on their personal business is so huge that they cannot come back. Another 25% of those companies which are impacted because of the sales that they lose, then they will fail within a year. And the rest of the company are the ones which are surviving and are potentially even increasing even more their business afterwards. So once more, another statistics to highlight why it is so important to be proactive, identify and find ways how to overcome a possible catastrophic event and being ready up front for that. So that's what we're going to discuss in more detail. Cool. If we look a bit more of the details of the business continuity planning, so that's a very important part for Roche. And what we do globally across all of our countries, we want to make sure that we have key business continuity management strategies in place to ensure that we have a resilient supply chain and we are capable of absorbing any disruptive incident. So here a quote from Dr. Gottlieb, which is a retired general counsel of Roche, where he was always clearly stating that we must prepare ourselves for the worst possible case. When we look at business continuity planning, there are 3 areas which are looked in more detail. So we need to sustain the business in regards to the capability. How do we continue to deliver our key products and services? In terms of level of operation, how do we identify what are the minimum and acceptance levels of operation? To give an example, we have in every place, and I think in every business, there are many different parts of the portfolio, but it's very important to understand upfront, prior to a catastrophic event to come, what would be the minimum number of operations which we require to be carried over to ensure that we don't create troubles to our ultimate customers, the patients in our case, and the customers in general for any type of business. And then we need to get ready to have something solid to be used as soon as there is a disruptive event. So we need to have a plan in place which can be immediately applied as soon as something happens. That's all in all what is about the business continuity. And there is a huge effort to be done in order to be prepared. First of all, we need to identify what are how do we define the disruption? So we need to properly position the disruption to identify what is its severity, how big is the disruption? Is the disruption have impacted me on my business only on a small scale? Is it a matter of assets, of machine which have been impacted, or it's also people? So there are many different things which we need to look to identify the severity of the disruption. Because upfront you cannot know what is the type of disruption you will be confronted with. We have seen before COVID-19, but there could be an hurricane or can be an earthquake. So a lot of things that can happen. The length of the disruption is also very important to be identified. So how much do we expect the disruption to last? So and based on this, we can also identify what is the best safety stock levels that we can put in different nodes of the supply chain to overcome possible troubles. And finally, the recovery. How long would it take for us to come back to speed? So, and this is depending again on the type of disruption. So do we need to rebuild a manufacturing site? Do we need to recreate our logistics provider? So what is the type of recovery that we need to apply? Last but not least, again, we need to identify what are the key products and the key activities which have to be taken care of. Specifically, Roche, we are divided, as I said, into 3 areas: Roche Pharmaceutical, Roche Diagnostic, and Roche Diabetes Care. Every year, there is a revision on what are the key products which have to be ensured a continuity of supply. Those of ones which are so important that we cannot get any problem to happen, mainly because of their medical importance. That means if a patient would not get that specific product, then they would have big troubles with their health. There is potentially for those products, there is no alternative in place, so we don't have any other generic forms or any other products in place. And as well for the diagnostic portion, whenever we have products which are so relevant for the continuity of the business that we cannot get rid of. So for those products, there needs to be an additional attention on the definition and the development on the business continuity plan. On top of this, we need to identify upfront what are the key activities which we cannot avoid to be done in order to ensure business continuity. An example here is when we look at our supply chain portion or as well into the manufacturing area, we don't have to do every single thing that we have been doing during good timing. For instance, quality release. Where do we need to have a mandatory quality control release, and where can we and when can we find ways to overcome this type of capability? And then we need to identify what are the key strategies that we want to put in place. And again, depending on the type of product that we do have into the scope, we may have more or less big strategies in place. We can think about dual sourcing. So, for instance, if we do have a manufacturing site in California, which is a potential risk of earthquakes, and we see that we have a specific, extremely important product on the pipeline, we may think about having a dual sourcing out of another manufacturing site in another part of the world where it's more tricky to have a similar catastrophic event happening at the same time. One example of key strategy can be dual sourcing. Another example is can be around also safety stock levels. What are the right safety stock levels that we want to put in place in order to avoid any disruption? And of course, all of these strategies comes at a certain expense because it's not easy to maintain a dual sourcing in place. It's not easy, and it's very expensive to have high stock levels in the market or in different nodes of the supply chain, and it comes as well at risk of creating problems of write-off risk. All of those things have to be taken into account when looking ahead at how to mitigate possible issues in the supply chain. So if we look at the type of disruptive event, what is part of the process of determining the business continuity plan is to link the specific potential event into 7 key losses that can occur. Because we don't know upfront what could be the type of disruptive event that we will be confronted, we have 7 different types of loss that we look at. One is a loss of premises. An example is, again, earthquake is coming, we lose a premise. That could be a manufacturing site, could be a warehouse, could be any other type of things when we look at the end-to-end supply chain. We can lose critical technologies or equipment. So that can be the case of we have a fire within a manufacturing site and we lose a specific portion of that building, or we don't have any more technology which we would require. We could lose also internet, or we could lose our informatic technology capabilities. And that's also something that we need to think about. Okay, well, how can we connect to each other? How can we keep the business running without informatic technologies available? We could lose critical utilities, but we can lose also employees. So unfortunately, that's also a thing that we need to look at. What if for a certain period of time we don't have any more the same workforce in place? How do we proactively mitigate this potential risk? That's unfortunately a specific case also of COVID-19. That's something that companies have to take into consideration. What if my workforce, at least for a certain period of time, is going to be reduced? Because we need to have preventative measures in place in order to avoid the spread of the virus, for instance. So an example here is in our site in Cape Town. The team has been identifying ways to work in shift model, where only 50% of the people have been working on site and 50% of the people have been working from home. And over time, this came to be a shift model that has now been applied since 6 months. Same happened for many other sites, also the site where I'm located in California. We have applied a workforce at 50% to be on site and 50% working remotely. And every 2 weeks we have been rotating the workforce to make sure that the potential risk as well of the virus to be spread were reduced as much as possible. That's one example, just to give you some indication of what has been done in the case of COVID-19 this year. And then loss of critical suppliers. So here it's something that can always come, and again, was a potential risk during the COVID-19 situation, but also can come in many other cases. In the past, a couple of years back, there was a tsunami that was involving the Asia region and Japan. And we had a possible big risk of supply disruption of some of the caps which are used for the syringes. And we had to overcome this. Luckily, we had, we had planned this ahead, and we were able to overcome the potential risk of not having all of the drugs will go under with syringes into the market because we had alternative sources of supply in place for the caps that was so critical for the syringes. And who would have thought that the issue could come from the caps which are used into the syringes? So that's very interesting case that happened. So when we look at the 7 type of losses, then what we do is making a risk assessment and identifying what are possible strategies that can be put in place in order to ensure that the key products and the key services are delivered to the market out of those 7 type of losses. All in all, we have to identify plan B, and in some of the cases we identify also a plan C or a plan D for how to ensure, again, proactively that we have a strategy in place to overcome a possible disruption in the supply chain. And when we look at the event, where there are main 3 phases where we divide the event. There is the event when the disruptive incident happens. That's time 0, so to say. And then the business continuity management focuses on 3 buckets. The first bucket is the local emergency management team, when this type of team comes into place, which really deals with the immediate hours after the catastrophic event has occurred. During this time, an IMT, incident management team, will be formed. And during the incident management phase, there is a lot of activities which have to take place in order to ensure that we have our people first looked at in terms of their how they are doing, in terms of communication, making sure that everybody is in a good shape, and then we can identify what is the overall impact of disruptive incident to our end-to-end supply chain. And last but not least, in the third phase is when we really then activate the different strategies that we have been thinking up front, and that's where the business continuity team comes into place. So those 3 phases are called, we have specific actions to be looked at, and specific action defined by site, by country, by each department, whereas it's going to be into the red phase or the yellow phase or the green phase, depending on the time at which the event occurs and how far after it is. So all of these comes to an end with the definition and the creation of a document which is used by all the employees in all locations of the Roche Group. Every location has a different document in terms of content, same structure, same approach, same definition, same terminologies being used. But you can imagine in all of our 150 countries, in every single manufacturing site that we have, everyone speaks the same language when talking about business continuity plan. And everybody has been thinking upfront and put in writing what should be done in case of a catastrophic event happens. And this is then, it's very important that we have top management support and top managers really driving this and signing off those documents. And being trained, everybody has to be trained on being ready to use those capabilities whenever a disruptive event happens. As soon as there is a disruptive event, there is a lot of emotions, a lot of stress which goes on. So it's much trickier to really being able to just think broadly on activities that could take place, on things that can be done to ensure business continuity. It is always great to have these reference documents, which are very detailed, and they clearly state what people should be doing and what they should look at to identify, again, the type of disruptive event that occurred, the severity of the impact, the length of the impact, and then looking at the different strategies which were pre-identified and put in place to support the business continuity. These type of capabilities do not only apply to supply chain, they do apply to many different areas and to all the areas that we have in the world. What it comes, every site again and every functions as this type of document available, which derives the free type of streams, so on the emergency management, the incident management, the business continuity. And then what it comes out into the documents, there are so-called swim lanes which describe what everyone has to do in order to run the same path, in order to move ahead of the problem and come into the post-disruptive incident situation. And then there are a series of checklists which are used to make sure that people really go through every single step. They do not miss anything when the managers look at the things which have to be done. So the last thing which happens, and which is extremely important as well, every year we do a revision of the manual everywhere around the globe. And every year it's revised what is the key products, what are again the key activities are still the same, they should be changed. And then there is an assessment which is done every year everywhere, and where there are internal auditors, internal support functions which are coming on site. They do provide a business case of a new catastrophic event to simulate. And then there is a simulation which involves all of the senior managers of the specific site of the specific country, and they identify if there is anything still pending into the manual that has to be improved, has to become more accurate. We just simply did this a couple of weeks ago in California, to give you an example. And we identified a few so-called map items, so which are things which have to be looked at for improvement, so to ensure that our manual is the most up-to-date and is ready to be used in case of a catastrophic event. Just to give a flavor, in this case, the simulation was around having some COVID-19 cases as well as a small earthquake that was preventing us to manufacture part of the portfolio and to supply and deliver the products. So last but not least, just to give you an insight, our CEO of Roche, which is Severin Svan, so I clearly highlighted during the COVID-19 situation how important it is to look ahead of possible risk, and how this early investment on business continuity is so important to ensure that we can continue to support our patients in a continuous way across the globe whenever there is a disruptive event. That will be it for my slide. I wanted to share again some insights on why it's important to look at the possible cases of possible situation of disruptive events, how the methodology is very relevant in order to make sure that everybody speaks the same language when talking about disruptive incidents. Everybody looks in detail of what are the key activities, key things that can be done, and things that can be avoided to be done after a disruptive event, and then identifying what are the key strategies that can be applied in order to overcome possible problems. So with that, I will be done with the presentation, and I'm happy to take any questions that we can discuss in more detail.
So, thank you so much for that, Fabio. Some really, really good insights there, and there are some questions. One of them is, what are the strategies to mitigate supply chain disruptions?
Okay, I can answer to that. So there are many different strategies that can be used to mitigate supply chain disruption. So I'll give you some examples. One of the kind of the one that comes easier into place is the revision and definition of the appropriate safety stock levels in different parts of the supply chain nodes. In order to do this, you need to analyze the supply chain, the end-to-end supply chain patterns, and identifying where are the key nodes where we want to put some more safety stock or less safety stock in place. That's one example. Another example of strategy that can be used is the dual sourcing. Dual sourcing means that if you have one site or one raw material supplier, you identify an alternative one that can be used whenever the first one is disrupted. In some cases, you may even want to identify free ones. You cannot do this everywhere across the supply chain, because then the supply chain becomes significantly costly and redundant. And but you need to do it at minimum for the key products or part of the supply chain which are most relevant. So dual sourcing is the second one. Then also there is a different other type of mitigation that can be put in place. One is around the logistic, identifying second carrier suppliers or a third type of carrier suppliers that can be used in case of a need. I think these are 3 examples of strategies that can be put in place, and there is not a one-size-fits-all. It's really depending on one supply chain, the cost behind that, what are the risks, and what can be done to prevent them.
Thank you. You're not done yet. I still have some more questions for you. Okay, so the question has been asked, is there a site you can recommend to find statistics on the pharmaceutical industry that show the effects of supply chain risk or disruptions? Or alternatively, could you share on how COVID-19 affected your pharma supply chain?
Okay. So on top of my head, I don't have him. So for sure, if you Google on internet, you can identify a lot of websites which talk about the disruption into the pharma world, disruption of supply chain into the pharma world, which is terrible to have, especially as I was mentioning before, if you have medicines which go to patients, which either they take that drug or they have a serious health issues. It's something that you definitely want to avoid. And that's why it's so critical, so relevant, and so important to proactively look at what are the disruptions. I think you can easily find in internet companies which have been impacted by disruptions. If they were not able to cope with the requirements across the globe, you will definitely find on internet those companies. I don't think it's fair for me to share names, but of other companies, but definitely you can find if there has been some disruption to patients. Specifically to Roche, how the supply chain has been disrupted. I'm on the diagnostic business. I'm not on the pharma business, but I'm in strong connections with the people on the pharma business. They had challenges, and they were extremely good at overcoming those challenges. Those challenges were, again, as I was mentioning before, one was logistic. It was much more trickier to identify ways to move material from one place to another one, because there were much less flights, and in this situation, so there were also cargo flights that were just booked by Roche just to ensuring that we were able to supply our products to different markets. The supply chain was also disrupted by availability of people in the manufacturing site. So every site of Roche, both diagnostic and pharmaceutical, we had to reduce our workforce to avoid the potential spread of the virus. And if you reduce the workforce on average by 50%, then you do have less output, and then you may not be able to support all of the requirements coming from the world, and that requires a very diligent work and extreme effort to make sure that you keep on providing the drugs to the patients in every part of the world where needed. So that was something that went on for all of the 8 months that we are into the pandemic, and I think it's going to continue for a while still. Our first site that got impacted by the COVID-19 was in China. And the nice part about being into a global world is that all of the other sites around the globe and all of the supply chain learned from the activities that were occurring in Suzhou, China, or in Shanghai, in our other manufacturing site. And then we were able to be more ahead of the game to see what we could be doing in order to prevent issues on the supply chain. So there has been challenges, but not disruption to our capabilities to supply to patients. Our on time in full to the countries has been extremely good this year. So that's really great. I think you're on mute.
Okay, we're not done yet.
No worries.
Diona, you put up your hand. Do you have a question for Fabio? Apparently, there is a way to invite them onto the stage, but it's not working out. Okay, that's not working. Okay, we have a question here. In terms of employee losses, can you spell out ways to reduce or mitigate disruption?
Sir, can you repeat the question once more?
In terms of employee losses, can you spell out ways to reduce or mitigate disruption?
Oh, okay, sure, absolutely. So when you look at employee losses, so okay, of course, you think about what happens if your workforce is going to be reduced, either for a certain period of time or for a longer period of time. And that's a typical example that we need to look at in case of a pandemic, like the ones which is happening right now. And what you do in those cases, so what do you specifically do is identifying, so there are 2 to 3 main things that you look at. One is with your existing workforce, you proactively try to do cross-training between different departments, so that if one group does, I give you an example, formulation, and another group does pack and fill, if we have a reduction of the workforce in one area, like let's say formulation, then we can have people from the pack and fill team being able to absorb those requirements. That's one example, or one critical action. So one specific actions that would be taken up front, and it's not just done like this. We do work into GMP environments, into which requires a lot of trainings to be done. So it's an effort. It takes time to come to a stage where there is a big workforce cross-trained into different areas. Another thing that you look at is identifying upfront what are the critical roles that you need to keep having, and how do you identify a backup for those critical roles, and or do you add some let's say some contractors to overcome those possible risks. So another thing that you look at is what we have been doing, for instance, I can give you an example also in California. So what we have been doing for preparing for this, we have identified, okay, what happens to our operations and our capabilities if we reduce the workforce by 25%, 50%, 75%, or 100%, depending on the type of pandemic that comes into place. And then based on those things, we identify, okay, if we have a loss of 25%, we think that the cross-training between the different departments is enough to still ensuring that our key activities, key products get delivered to the customers. If we come to the 50%, us alone in California cannot make those things. And then what we have been looking at is, do we have people in the network of Roche that have a similar skill set that we need to do the activities that we have to do in California? And to the 75% and 100%, we also look at, do we have some workforce that we can have ad interim, some contractors that can come, some consultants that can come and help out during this case. And what does it mean? So what does it take? Which companies do we work with in order to have some additional workforce readily available in case of need to try to mitigate as much as possible. And this comes in combination to, while you do try to risk mitigate by cross-training, by adding additional employees and so on, in the same time you also reduce what you have to manufacture, the number of TTs that you have to do, so that you try to balance out both overcoming the issues of not having enough people with as well reducing the key things that you have to do. Not everything that you were doing before you have to do afterwards. And that's the beauty in a way of this methodology and these thoughts that go around. Oh, you're on mute, sorry.
You're muted.
I still can't get this right. You still can't go. I have one more question for you, and then we'll wrap things up.
Sure.
Does Roche use a model to manage or mitigate supply chain risks? In case of the pandemic, what strategies did you apply to ensure business continuity?
Yeah, sure. We do have a methodology. That's the one which I gave you very short insights on, that we do apply to proactively look at disruptions in the supply. And the nice part about that is that this is in place since many years. So we were not caught by surprise with the pandemic, because in terms of risk mitigations, because we had those plans already available, and for which all of the senior managers were already trained, and everybody was already knowing more or less what to do. And again, specific to this pandemic, we applied several of those capabilities, because the pandemic had a significant impact on many areas, a potential significant impact on many areas, from raw material supply to capability to manufacture what we were manufacturing, to the capability to bring the material to the patients ultimately. And in all of those stages, we have been implementing different type of metrics. I just say maybe one closing word. For me, the most critical part during this situation is communication. It's never enough to communicate during these crisis situations between each other to understand what's going on and how one can help to each other. We do have this very well described series of activities which have to take place and things which have to be done. To me, the most important one, the key for success, is keeping up with the communication to overcome the specificities that every specific country, every manufacturing site, or every part of the supply chain may face.
Okay. Just when I think that we are closing questions, this is the last question we're going to take now, I promise. Okay. So, how did continuous flow of information facilitate your business continuity plan?
Right. Continuous flow of information is, again, it's important, and it has to be done in a coordinated approach. Otherwise, it risks of being even more disrupting than helpful. So it's not good enough to just bombard each other with additional information. It's important, again, to see and to relay in communication which is most critical. One thing that we have been developing across the globe, so during this pandemic, is also we have been tailor-making specific IT solutions, reports, that were extremely helpful, for instance, to keep track of critical raw material supplies or of delivery situations. And I think we may even realize at a later stage how we enter much more into digitalization into the last 9 months than we were before. And how did we use more and more the informatics solutions to have our systems reflecting more and more the reality and what is really available for us. So yes, definitely informatics solutions have helped us a lot during this period. We have been in a way also even improving on the usage of these IT solutions. But it's very important that this is done in a coordinated fashion. Otherwise, there is a risk of having part of the groups which are bombarded by questions and by information which is not easy to be managed.
Okay. Thank you, Fabio. I'm going to let you off the hook here. I think that was really valuable and insightful. I think there's a lot of really good takeaways from the session that people will be able to use and apply. So we are very, very grateful for your time at when you started 5:30 in the morning. So I think these are important things to mention, that because of our speakers and some of our participants being all over the world, they really are having to give up some sleep to be here with us in the mornings. So we're very grateful for what you've shared today with our supply chain community. And like I said, I think some really good words of wisdom there, something to take away, people to look into more, and really to consider their risk strategies and risk plans in a lot more detail. I think that COVID caught most people short, and I think it's a lesson to be learned moving forward, that they've got things in place to make sure mitigation strategy so that it doesn't happen again. So thank you so much, Fabio. We appreciate your time. In terms of today, the formal presentation sessions are done, but there is opportunity to network until 5 o'clock. The platform will be open. So I'd like to encourage you just to spend some time on the platform, networking, catching up, chatting with your peers. And please do not forget to complete the poll on the right-hand side, just so we know what your thoughts are on the presentation session. It's valuable information for us. So thank you all, and I hope to see you somewhere in the lounge or on a booth somewhere before everybody leaves. So thank you very much, Fabio. Thank you once again, and we hope to have you back again soon.
Perfect. Thank you, everyone.
Thank you.